Hello, my name is Ostomy Management, and today we're going to talk about the different type of, or excuse me, the ostomy cares. To start, we're just going to talk a little background. The different types of colostomies or ostomies, it depends on the area of the location of the intestines, and also what to expect once you look in the bag. The closer to the end of the intestines is going to be more of a solid content. The higher up in the GI tract is going to be more of the liquid. It doesn't have enough time for there's less amount of time for the intestines to absorb water throughout. So obviously, if you're at the lowest, like I said earlier, it's going to be the most formed. But that's the background on that. Um, Also, you want to always make sure that the ostomies are look like they have oxygen supply. So like red, pink. Make sure that it's not a dry, dusky look to it because then there's not oxygen coming to that area. Make sure that it's a pink color. Um, so that's a little background on that. Also, anywhere just have family experience with these colostomies. Anywhere from a third to I say a quarter to a third full. You want to definitely go ahead and empty those, and also burp the bag. I guess you should say if it fills up with gas. Just make sure it doesn't just get really large when there's not much content in it. It's just the bag is full of air or gas. Also, um, this may be a little uncomfortable for some patients, so definitely have respect for your patients. Show them the right courtesy, and just make them just build a rapport with these patients because a lot of patients are very insecure about these. So first off, you want to check your physician's orders that this is the correct patients that you will be performing these tasks on. Make sure that you are in the correct patient's room by properly doing an identification. You can actually ask your patients for their first and last name, date of birth, compared to the armband, which would be your identifications. You want to wash your hands, get clean gloves, which I have now, Don Clean gloves. Also, throughout this task, you will need an absorption pad. This will to keep the patient clean from having any feces or liquid coming onto them, and just to keep everything clean. And just, they're already, in a sense, it may be or may not be, depends on how new the colostomy is or any ostomy. So this here is usually rolled up more and has a clamp on here. So I'm just going to kind of hold it like here. So this is what it's supposed to look like, a clamp holds it across. And obviously the stool or feces would kind of accumulate in here, and periodically we would check it and drain it. So have that underneath there. Then you also would need some sort of container or reservoir to empty the colostomy into. This is another important. You would have to have the absorption pad, this here, and as well as the clip for it. See, this one doesn't have a clip, but this is very important to have because obviously it would not hold the contents in the bag. So we're going to use this bag that's already on this here mannequin. So the first step is we would explain the procedure to the patient and then transition straight into it. So we would unclip this here, okay, holding it upright, because if you did it down low, you wouldn't be able to control it. So gravity, we're going to unclip it, okay, like this here. Making sure that if we're going to completely drain it, or if we, like I mentioned earlier, burping the bag, at this point here, you could just release it, allow the gas to come through, and then kind of flatten it a little bit to make sure, and then close it back up. But for this purpose, we are going to empty it. So we have the content inside. We're going to use this here. I like to kind of control it, like bend it in half a little bit, holding it upright, and then place it in this here reservoir or container. And then whether use gravity and allowing it to control the route into the bucket here, you can just place it here to lower gravity, allow it to flow in, and kind of grab the bag and squeeze it into here. Again, depending on the location, it really depends on the type of um, content that's going to be in this bag. Sometimes it may just fall all out, or sometimes you may have to just maneuver the content out of the bag. Once it's all out of here, you set this aside, and you want to get a rag to clean the let me see, clean the inside of that bag. So we have your rag, and when I say clean the inside, we're not going to go all the way in, but we are going to clean this area here. Okay, see if you can see in the video this inner area here. So we're going to clean the inside of that. Okay, clean everything. Once it's cleaned thoroughly, you want to roll back up your bag and take your, it's like a clip. It clips right here and it holds this area in here. Once that's done, then you want to obviously take all your supplies off of your patient and set it on the, say on the side table or on the side out of the way. Take off your gloves, wash your hands immediately. Let's then document. Let's document the amount of volume that came out of the bag, the type of volume, whether it was more of a formed or liquid, a certain color, if there was any odors, depending on whatever you notice with the stoma, patient's response, anything taking place during that procedure, you need to document it to protect yourself and to help the transition with the healthcare treatment team. If it's if this stoma wasn't pink, if you came in and you noticed it was gray, well, how long has it been that way? Let's go back in our records and see, okay, well, it was pink here at 11 o'clock, and now it's excellent time, and it's necrotic or, most extreme. So that's where this comes in a really important to make sure that we document everything accurately and everything we do see. So this is all closed up. I have documented everything. Take off, have my no gloves on at the time, I'm just typing. I come back, I wash my hands again, put gloves on now, and I'm going to discard of all the equipment on the side table, all the equipment I used. Okay, I'm going to put it in the proper area and dispose of it, again, in the appropriate areas. And sometimes patients, depending if they have, say some of patients, and this is just speaking from experience with a family member that has one of these, there may be a band. If they're out in public walking around, they have something that kind of holds it to them and kind of, so it's not just flopping, underneath. It doesn't necessarily press it hard against them, but it does keep them in a certain area where it just not is very noticeable or whatnot, just to kind of give them a peace of mind. And that another thing is you never want to spray any kind of a perfume or anything inside of the bag. They do make bags that supposedly will help control the odor, but again, this is what's taking place. Does have a foul odor, but it's just part of it, that is everything on the cleaning part of it and making sure the flow of everything thoroughly. Another thing is I want you to, the site, you want to make sure that this here is secured, the bag and this piece is secured to it. You make sure that everything is good, that it's on each side of it. You notice here, say, it may have a route out. That makes sense, that everything is adheres properly to it, and that everything looks like there's blood flow coming to the ostomy, and that everything looks secure to it. That is all to colostomies or ostomies cares. Again, depending on the location, we'll tell you there's certain type of stool or feces, the formation of it. That is all to ostomies. And my name is Arthur Bienvenu, and thank you so much for watching.